Elizabeth Warren had her town hall the other night. Sam played the main takeaway yesterday. Abolish the Electoral College. Excellent. She's 100% right. I'm glad she's putting points on the board like this. And I think this was a pretty good answer on white supremacy as like an actual security threat. And again, on one hand, I want us to kind of introduce way less securitization discourse into our politics in general. And on the other hand, obviously things like Christ Church or Tree of Life Synagogue are white supremacy-based terrorism.
Good evening. Since the election of Donald Trump, the number of hate crimes has increased, and white supremacists have become more emboldened online and in public. What are your plans to unite the country?
Oh, good. Thank you for that question. You know, it starts with the fact that we've got to recognize the threat posed by white nationalism. White supremacists pose a threat to the United States like any other terrorist group, like ISIS, like Al-Qaeda, and leadership starts at the top. And that means you've got to call it out. No sitting by. And then when you call it out, as President of the United States, you got to use the tools available to you. And that means get the Justice Department, when they break the law, to go after them with full prosecution. That's what I can do. Thank you.
I think that that's a good answer. I think
she also mentioned the stuff Obama was doing with the DOJ and police departments in another part of the town hall.
Okay, that's good, because that's the connection that I was going to draw. It has to be a part of a whole, again, it's a very weird balance to pull off, because I generally think that obviously something like the Department of Homeland Security is an enormously problematic thing whose power and access I do not want to expand. But obviously, to the extent all of these agencies have power and have a role to play in legitimately disrupting crime and terrorism, obviously right-wing and white supremacist terrorism needs to be at the center of that, because that is objectively what the biggest threat is right now inside the United States. And in fact, of course, has been historically. But in addition to that, you need to connect it to a whole broad sweep of police violence, of racial discrimination policies and violence across the board, particularly with regards to law enforcement. That's the dialectic you need to pull off. But that's great that she connected those themes, and that's a good answer. Here's the problem with Elizabeth Warren. She keeps equivocating on Medicare for all. And if you listen and talk to somebody like Jamila Mishner, who is one of the premier scholars of Medicaid and healthcare in this country, while balancing this nuanced and brilliant history of the compromises of things like the New Deal and the Great Society, I asked her, I said, what do you think about the Sanders and Jayapal bills? And, her basic perspective was, if these bills get passed, we are light year. Like, Americans are in another planet in terms of better off. And the only concern that she has is the robustness of long-term care in both of these bills. So the point I'm bringing up by saying that from a serious scholar and a real humanitarian like that, frankly, is single payer is in some respects the compromise. And the only valid conversation, the only valid moral conversation you have about this, the only valid political conversation you have about this, is the extent to which you are going to fully fill out from mental to dental to every type of conceivable care, universal health care, and completely get rid of the parasite HMO insurance company model. Period. Full stop. So on the merits, this is so disturbing that she equivocates about this. And then the politics, how she understands politics. Bernie totally understands that in order to pass any type of even remotely progressive program, you need a totally mobilized society. And so when she equivocates like this, it's like, is she thinking about that mobilization, or is she thinking about some wonky negotiation process? And that's a big concern for me. So let's play that.
He has a question about Medicare for all. Jay.
All right.
Senator Warren, thank you so much for being here this evening and your tireless advocacy for universal health care. As a supporter of universal health care and an advocate for organized labor, I do worry about the current bill's elimination of private health insurance.
Oh, yeah.
As that would eliminate the private health employer-based plans that so many unions have advocated for.
It's a dumb question.
Can you explain how Medicare for All would be better for workers than simply improving the Affordable Care Act?
Okay, so it's a good question. Let's start with our statement that we should make every time we start to talk about changes in our health care. And that is, health care is a basic human right, and we fight for basic human rights. And then let's put these in order, because I appreciate that your question starts with the Affordable Care Act. Let's all remember, when we're talking about what's possible, let's start where we are and the difference between Democrats and Republicans. Right now, Democrats are trying to figure out how to expand health care coverage at the lowest possible cost so everybody is covered. Republicans, right this minute, are out there trying to repeal the Affordable Care Act. They've got a lawsuit pending down in Texas where they're trying to roll it back, what they couldn't do with a vote, they're trying to do with the courts. HHS every day is doing what they can to undermine the Affordable Care Act. So when we're talking about health care in America right now, the first thing we need to be talking about is defend the Affordable Care Act, protection under the Affordable Care Act. Then part two. Let's make the improvements that are what I think of as the low-hanging fruit. For example, let's bring down the cost of prescription drugs all across this country. We got lots of ways we can do that. We can import drugs from Canada where the safety standards are the same. That would cut costs dramatically. We can negotiate prices under Medicare. That would cut costs dramatically. And I've got a proposal to help bring down the cost on generic drugs, which could be about 90% of all prescriptions. So let's get those costs down. And then you know what you're going to hear from a consumer advocate. And that is, we need to hold insurance companies accountable. And that means no tricking and trapping people on those insurance contracts. And then when we talk about Medicare for all, there are a lot of different pathways. What we're all looking for is the lowest cost way to make sure everybody gets covered. And some folks are talking about, let's start lowering the age. Maybe bring it down to 60, 55, 50. That helps cover people who are most at risk and can be helpful, for example, to the labor's plans. Some people say do it the other way. Let's bring it up from everybody under 30 gets covered by Medicare. Others say let employers be able to buy into the Medicare plans. Others say let's let employees buy into the Medicare plans. For me, what's key is we get everybody at the table on this, that labor's at the table, that people who have to buy on their own, everybody comes to the table together, and we figure out how to do Medicare for all in a way that makes sure that we're going to get 100% coverage in this country at the lowest possible cost for everyone. That's our job.
So, look, okay, all of the stuff about prescription drugs, that's great. In fact, she didn't even mention her most interesting plan, which is government producing its own drugs. That's actually a great proposal. That's fine. She's wrong. The midterms were the vote on protecting Obamacare. And those of us who are 100% pro Medicare for all and understand that is the only moral and policy answer, full stop, period, that Obamacare made great strides. Mostly on the coverage end, it was the expansion of Medicaid. And then it was essentially consumer protections. Now, I could tell you, which is also really important, and I could tell you, if you're on the exchanges, yes, it's of course better to possibly figure out a way to have health care than not. But it ain't good. And if you're in many different categories of people, even with subsidies, paying a lot of money for crappy private plans, and you think that that's durable, first of all, the companies will always push back and always eat their way out of obligations because they're parasitic. Their business model literally is built on taking your money and then denying you care. That's how the profits work. And then on top of that, even though the Republicans, of course, are liars and their alternative is worse and horrific and obscene, and we pushed it off in 2017, they'll always have a talking point. As long as they're in the beginning of Obamacare, I'll be transparent, I was so broke that the financial calculations did not make sense. Then I got to a point where I kind of figured out, look, I do it. I'm not thrilled. Like that actually hurts me financially, what I have to pay, and what I get ain't nothing.
Yeah, it's ridiculous.
You're paying for a card if you're on any of these programs that like aren't worker provided or job provided at this point.
That's it.
Or if you're on Medicaid.
It's ludicrous.
And
it's insane.
And that guy, it's a very weird question because, okay, you have employer insurance. Lovely. I thought you're a union organizer and you're aware that jobs are like this and like this and like this. And one of the biggest agreements even around Obamacare was people like Nancy Pelosi, of all people, saying if we decouple your ability to have health care from your job, you'll have more freedom, which is true. So
you still negotiate other things or even supplemental health insurance like they have in a lot of countries.
Right. So it's a very weird question. So first, her timeline's just off. I accept those of us who are Bernie did this perfectly. Medicare for all is the long-term goal. The short-term fight is fight the Republicans' effort to destroy Obamacare. Right now, and until 2020, and certainly if Democrats win, Obamacare is protected unless the courts do something insane, which is a whole other set of questions. So, wrong timeline. And then the bottom line is that it is not about a negotiation. It is not about this and that at the table. It is about these companies do not provide value, and every single category of conceivable human being in this country needs full, complete, no nonsense, no bullshit, point of contact healthcare. And also, quickly, we do know how we can get there. The Sanders and Jayapal plans are real plans. They may not be perfect, as nothing is perfect, but those are not goal-setting bills. Those aren't like a paragraph that say everybody should have health care. Those are detailed, scored-out plans for how you do this. And they're the bare minimum. They're both good bills, particularly the Jayapal bill. That's it.
The way she says the goal is to try to get everybody covered as cheaply as possible, like how does she think that sounds appealing? Because it's clear what is going to suffer in that calculation. It's going to be what you define as covering everybody.
Right. 100%.
Cheaply as possible is not my goal here.
Right. And it doesn't fit. Like, I don't know what lane she thinks she's playing in. She's got genuine claims to progressive and moral leadership. Why is she compromising that on healthcare? It makes no sense.
This sort of hedging towards, well, we got to be able to deliver something once we get into the room. It's like you're not in the room yet, so go in as aggressively as possible so
and
that
she
you
was
have
somebody,
some sort of leg up.
And she said this contemporaneously. She was someone inside the Obama administration saying, what the hell are you doing? Yeah. So she already knows this. It's very peculiar to me. All right, a few more items.